Hey guys, Dr. Kyle Loveless here. Hey guys, I want to help shift your thinking so you can shift your health. It's such a big thing to think about right now is because the way we think really decides how we end up, if that makes sense. Like, what do we actually believe? What's your belief system when it comes to health? So many people believe that if we had a better insurance system and we had someone else paying for our health, then we would be healthier as a country as a whole. Well, the truth is, right now, America is the sickest country in the industrialized world. Not only do we spend more than everyone else, we have more doctors, we have more hospitals, we have more technology than anyone else, but we're the sickest country in the world, right? Our life expectancy is actually decreasing in less than most countries. Our infant mortality rate is higher in America than it is in the top 37 industrialized countries in the world. I want to repeat what I just said there. Our infant mortality rate is higher in America than it is in any other industrialized country. That is huge. I hope, I mean, I just think about that. Let's just think about all these statistics right now. 1 out of 2 people gets heart disease, 1 out of 3 gets cancer. I think it's kids or autism rates are 1 out of 30 or less than that now. It keeps changing so drastically fast. We have massive amount of vaccinations and chemicals. We have more drugs, more hospitals, more technology, more doctors, more everything than every other country in the world, yet we're the sickest country in the world. So if everything I just said, if we just took all that, put it into a bundle and said, hey, this is our healthcare system, and if all that was the answer to our health, because that's what we're doing, there's no question about that. If all that was the answer to our health, where do you think we would rank? Would we be the healthiest country in the world? Just think about that for a second. If all that was the answer to our health, we would be the healthiest country in the world. You've heard this before, but the definition of insanity is to keep doing the same thing and expecting a different result. If we keep doing the same thing, regardless of who's paying for it, if it's the insurance company that's paying for it, great. If the government gives everybody free healthcare, whether you believe in that or not, it really doesn't matter if you're using the same broken system. So our healthcare system is broken because it's not a healthcare system. You can't call it healthcare anymore because it's not caring for health. It's caring for disease and sicknesses, or what the system in general has put in called diagnoses to treat. And there's treatments for that. And then the insurance company, we want them to pay for those treatments, but the problem is those treatments are causing disease. From day one, when we start pumping chemicals into our body, it's building disease from that same system that we're trying to use as our healthcare system. Okay, so shift your thinking, shift the thinking. Let's go back and let's just say you knew nothing about our current healthcare system. And let's just say day one, you're thinking, okay, I need to be healthy. You see people, sick around you, like, what can I do to be healthy? Is the first thing you're gonna think, what drug can I take? No, because you had never been taught that, so you wouldn't know that. Your first thing you would do is say, okay, what does my body need? Well, my body needs clean water. My body needs good oxygen. My body needs good food and nutrients and minerals, right? So I know all that. So I'm going to give those things. I believe, and I know that my body needs to move. We know that if you just sit and you're not moving, you break down. We've seen that over and over again. That's why, if somebody has a shoulder surgery, the first thing they want you to do is start moving. I had a patient came in and had 2 double knee surgeries, and the next day they're already out walking because they need to get moving, because if you don't, the joint stops working, and that's everything in your body. Movement is the key to life. So we know we need to move, right? So you're going to do all those things. You're going to look at your food that's coming into your body. You're going to make sure there's plenty of nutrients and minerals for it. Not so much worried about the taste as much as you are just that it's going to feed you, because that's where health is going to come from. You're going to look at rest. You probably need to regenerate, like my cell phone, it's going to die if I don't recharge it. So I got to plug that sucker in. So you need to regenerate. So you're going to need some rest. You need some sleep. Okay. And everybody's different on how much they probably need, but 7 to 9 hours is good. And then you need to move. So exercise is a good idea. And truthfully, not just exercise, you should be moving all day long. That's it. If you find yourself sitting like right now, I don't want to sit more than 15 minutes. I want to get moving quickly again, okay? So you need to move and exercise. You get oxygen, get more oxygen, and get your heart rate up so it gets used to being stressed, so it gets stronger, right? Get your breathing up so it gets used to getting stressed, so it gets stronger. Get your muscles moving, lifting weights so they get stressed, so they get stronger. You've seen it in nursing homes, when people stop moving, they wear down, they break down. They've had plenty of studies where they went to nursing homes and they would, or retirement communities, and they would have people do strength training, and they would actually have way less fractures or hip fractures, hip falls, breakdown, and degenerative issues in that community. So you got to move. The other thing is you have to have good alignment. We know if you're cuddled up like this, you can't breathe. So just try this. Try cuddling down like this and taking a deep breath. You can't, because your lungs are being compressed. You also are putting pressure on the nerves that control your body. Your organs and tissues and cells run on the nervous system, and those nerves go through your spinal cord, and so you're stretching and damaging the spinal cord and the spine. So we got to have good posture and good alignment. So we know that's essential. And then we also know the way we see things matters. So your mindset is essential. The way you see things, everybody knows that your perception decides your reality. So if you look at something, we have two people with the same scenario, one's miserable, one's happy. It's all about how they perceive it. And what the studies have actually shown is that based on stress is that if you see stress as something that causes heart disease, cancer, diabetes, and all these major health issues, then that's what it's going to cause. But if you see emotional stress as something that strengthens you up and builds you and makes you stronger, then you'll actually receive it that way. So looking at your stressors and figuring out, okay, what am I going to get from this? How am I going to grow from it? So my point is, guys, is that we have to shift what we're looking at for healthcare. No longer can we just go to our doctor and say, what can I do for this symptom? Because that's symptom care, that's treatments. And your symptom isn't a disease. Let me repeat that. Your symptom isn't a disease. Your headache isn't a disease. Your back pain isn't a disease. Your digestive problem, I don't care if it want to be diagnosed as ulcerative colitis or irritable bowel syndrome or what, it's inflammation in your gut no matter how you look at it. And so it's not a disease. It's a symptom that's coming from your body trying to adapt to a horrible environment that it's been put in, right? It's put in an environment, it's just trying to survive. Right? So it's about figuring out, what is your body telling you? So shift your thinking. Instead of saying, okay, I'm going to go to the doctor to get rid of my acid reflux. Think to yourself, why am I getting acid reflux? What is my body trying to tell me right now? What is it trying to get rid of? Or why is acid actually coming back out of my stomach into my throat when it should be closing off and holding in there? And start to investigate that and figure out, is it because my acid levels are too high maybe? Or maybe they're too low? What is it? Most of the time it's too low, but just figure, you gotta research and look into that. And the problem with just going to your doctor and saying, okay, why do I have acid reflux, is they don't know. They don't know. They're giving you acid hindering, or things that reduce acid, when acid reflux most often comes from too much and not enough acid, in your stomach. You see what I'm saying? So if your blood pressure is high, instead of saying, well, go to your doctor and say, doc, why is my blood pressure high? They don't know. They'll say salt, which is wrong. Or they'll say stress, which is right, but they're not searching for the stressor. They're just saying, don't worry about the stressor. Don't worry about the fact that your body is just trying to increase your blood pressure so you can get more oxygen and things like that in blood to your tissues. Don't worry about the fact that your adrenals are probably in overdrive and they're causing you to be in a fight or flight response and stressed out all the time. Let's just take this medication and get rid of that blood pressure so that I can tell you you're healthy again and I can look like a good doctor. That's a hoax. That's messed up. That's not real. If somebody came into my clinic and they had back pain, because we get a lot of people with back pain as a chiropractic clinic, and they come in with back pain, I just said, oh, hold on, let me go get you this. And I came back with, a pain med or a muscle relaxer or an injection, and their pain went away. I looked good for the moment, but I just made them worse. I just said, your body's stupid. It shouldn't be in pain. Let's get rid of that pain. You'll be good. It's like going to you hear me say this all the time. It's like going to the mechanic when your check engine light's on, and then just taking a piece of duct tape and putting it over the check engine light, right? And telling you that'll be $100. That'll be $200. That's wacky. That's what's happening when you're going to the doctor. And I'm not doing this to knock down on any doctors or anything like that. There's plenty of good medical doctors out there that actually see reality and realize there is a cause. There are things that are happening in our health. We need to address those, not just covering it up with medications, but the mass majority of that system in most of the hospitals and things like that is based on, what's your symptom? What's your test result? What's this? Here's your drug. Go take that until it gets bad enough. Then we'll do some surgeries. We'll cut some organs out. We'll cut your gallbladder out. We'll cut your uterus out. We'll cut your ovaries out. We'll cut your stomach out. You don't need all your colon anyways. Crazy, yes. Every one of them is important. God put all those as one thing that connects together and works in symbiosis together. You take your gallbladder out, now you're not breaking down fat and you're getting sick. You take your appendix out, now your immune system's messed up. You take out your tonsils, now you have a weak immune system. Those are all important. You put tubes in your ears, now you have messed up sinuses and other health issues down there. It just doesn't make sense. So shift your thinking, look at a different approach. First step in shifting your thinking is saying why. Just ask that question, why? Why do I have sinus problems? Why do I have allergies? What are some things that might be causing my allergies? Not there's pollen in the air, because there's pollen in the air. I don't get allergies. right? What about the people that aren't getting allergies? That's your question. Anytime someone comes in and they say, I have neck pain, it's just from stress. So you're probably right, but that guy over there is stressed. He doesn't have neck pain. Or people will come and say, my back pain is just because I need to lose weight. I've seen lots of overweight people without back pain. Or they'll say, my family just has it. Well, what about your brother? He doesn't have it. Or, I have the flu. It's just because the flu came around this year. Well, why didn't your spouse have it? Why didn't all the other coworkers? Why am I not getting it when you're sitting right here, right in front of me? Those are why questions. Ask those questions. And when you start asking those questions, then you're going to go down a trail, and that trail is going to take you to the truth. Not to get weird, but it does. And you keep asking questions and you become the health expert after a while. And that's essential in the world we live in today, because if you're not the health expert, somebody else is going to tell you what to do, and you just have to trust they know what they're doing. And most of the time, most people, most docs, they just don't. I'll be honest with you, no one knows I don't know everything about the body. So I'm always learning as well. So you need to, when you're looking for a doctor as well, this is the other thing. When you're looking for a doctor, you want someone that's going to take the least invasive, most natural approach to getting you better, and that's going to teach you about your body, how it's made to work, how it operates, how it heals, and it's going to teach you about, and it's going to help you start to decipher the stressors in your life that are causing the health problems that you're dealing with, and then evaluating those together and start to work to correct those and get rid of those while you're working on helping your body adapt to its environment and become more resilient to stress. Cool. That's where health comes from. So hopefully that was good for you guys. And sometimes I just go on a rant. Hopefully that didn't just happen, but you really got something out of it. Hey, if you got something from that, share that with other people. I'm trying to do this every week or even bi-weekly, just to shift your thinking, shift your health concept to where you can start to look at things differently. Okay, and each week I'll do it different. It might be on a certain symptom, like I think I did on shoulder problems. Shift your thinking on how you see shoulder problems. I did one on chiropractic. Shift your thinking on how you see the chiropractor and what that actually means to go to a chiropractor, and all those things. And I'm a chiropractor is my trade, and people think of that, think back pain and neck pain and everything else, but I'll tell you that the most educated people I know in the healthcare field, and I'm not saying that because I'm a chiropractor, because it's the most educated people I know. I'm not talking about book smart because the books are written by the pharmaceutical company. I'm talking about understanding how the body works and understanding different therapies and things you can do to help make your body handle stress better and get better is going to be in chiropractic. True story. Across the board, because we see things differently. We're looking for not just the cause, but we're looking at a philosophy that says your body is powerfully and wonderfully made. It heals from the inside out, not from the outside in. It happens no other way. And with that philosophy, we can start researching and learning and studying and learning more and more about health to where we can say, okay, does it line up with that? And if you say this drug is going to heal you and cure you and everything else, can't. It's not possible. It doesn't line up with how the body operates. So I don't believe that any chemical will always block your body's ability to adapt, which will always make you sicker. So it can't be true. So if you understand philosophy, that's big too. We'll talk about that at a different time. Hey, you guys have an awesome day. Love this, like it. Hey, if you got something out of it, share with other people. If you want to send comments, you think I'm off the rocker a little bit, cool, tell me. It's cool. I'm good with that. But hey, start investigating, start learning, start asking why. You guys have an awesome day.